My name is Ichiro Sekiya. The title of my study is Medial Tibial Osteophyte with strongly reflects medial meniscus extrusion distance and medial joint space with moderately reflects cartilage thickness in knee radiographs. Osteoarthritis of the knee, OA, is a painful disease causing impaired walking function due to knee pain, characterized by cartilage loss and osteophyte formation. 60% incidence among women over 60 years old in Japan. This is a radiograph image for normal knee and severe osteoarthritis knee. Radiographs are the most common examination for osteoarthritis. Joint space in a radiograph consists of 3 layers: femoral cartilage, meniscus, and tibial cartilage. Radiographs do not demonstrate each layer. We are developing a 3D analysis software for knee MRI. After importing MRI DICOM data, this software automatically extracts bone, cartilage, and meniscus and shows 3D images in a few minutes, even a notebook computer. This radiograph shows mild narrowing of the medial joint space and shows osteophyte at the medial compartment. The 3D cartilage image shows cartilage thickness is almost normal at the femoral side, but decreases at the tibial side. The medial meniscus is extruded medially. The majority of knee osteoarthritis is a medial type, which requires the evaluation of osteophytes and joint space narrowing in the medial compartment of the femorotibial joint. The presence of osteophytes may be associated with cartilage wear, the most characteristic feature of osteoarthritis-based changes. However, a recent report has shown an association between the medial tibial osteophyte width measured in MRI T2 mapping and medial meniscus extrusion (MME), one of the key pathologies in medial knee osteoarthritis. The minimum joint space width is composed of femoral cartilage, medial meniscus, and tibial cartilage based on anatomy, but which component is the most important cannot yet be determined. Some reports have indicated an involvement of cartilage thickness, while others have indicated an involvement of medial meniscus extrusion in the minimum joint space width. Our questions were: what does the medial tibial osteophyte width mean? And what does the medial joint space width mean? We performed MRI survey of Japanese knee osteoarthritis by 3D MRI. We called it Kanagawa knee study. Initially, 573 subjects were enrolled, but 11 withdrew, and 1 had negligible data, leaving 561 participated in this study. A further 34 subjects were excluded, leaving a total of 527 subjects ages 30 to 79 years that were included in the current analysis. Osteophyte width and minimum joint space width at the medial compartment were measured from a radiograph. Medial meniscus extrusion distance was measured from 2D MRI images. Medial regions at the femoral and tibial cartilage were divided into 9 subregions, and average cartilage thickness in each subregion was automatically obtained. Results. This table shows correlation of osteophyte width with cartilage thickness and with medial meniscus extrusion distance. Osteophyte width and cartilage thickness showed significantly negative correlations in the 7 subregions. Among these, the lowest correlation coefficient was found for MEMT, middle external medial tibial cartilage subregion. Left graph shows relation between osteophyte and cartilage thickness. Correlation coefficient was minus 0.33. Right graph shows relation between osteophyte and medial meniscus extrusion. Correlation coefficient was 0.76. The graph below shows that correlation coefficient was significantly higher for the medial meniscus extrusion than for cartilage thickness. Important point is, medial tibial osteophyte width strongly reflects medial meniscus extrusion distance. This table shows that minimum joint space width in radiographs and average cartilage thickness in MRIs. This showed significantly correlations in the two regions and 15 subregions. Among these, the highest correlation coefficient was found for MEMT, middle external medial tibial cartilage subregion. Left graph shows relation between minimum joint space width and cartilage thickness. Correlation coefficient was 0.50. Right graph shows relation between minimum joint space width and medial meniscus extrusion. Correlation coefficient was 0.16. The graph below shows correlation coefficient was significantly higher for the cartilage thickness than for medial meniscus extrusion. Medial meniscus extrusion can be detected by evaluating the medial tibial osteophyte width on plain radiographic images. MRI and ultrasound can directly evaluate medial meniscus extrusion, but these methods are not usually the first choice. Evaluating medial meniscus extrusion by routine imaging of the knee alone is very useful in clinical practice. Left panel shows KL grade 2 osteoarthritis with prominent osteophyte. Surgical treatment for medial meniscus extrusion is needed. Right panel shows KL grade 2 osteoarthritis with prominent joint space narrowing. Improvement of cartilage metabolism is needed. In clinical trials of disease-modifying osteoarthritis drugs, DMODs, subjects are often selected by KL grading in radiographs. In this method, two kinds of pathologies are mixed. Only joint space width should be used as an indication criteria. In conclusions, medial tibial osteophyte width strongly reflects medial meniscus extrusion distance. Medial joint space width moderately reflects cartilage thickness. Thank you for your watching.